The Child Care and Development Fund, also known as CCDF, Supporting Working Families and Early Childhood Development by Zenira Flanagan. What is the CCDF? The Child Care and Development Fund is a federal and state partnership program that provides financial assistance to help low-income families afford child care. It was created to promote both economic stability and early childhood development. The program helps parents work or attend school while ensuring children receive quality care in safe, nurturing environments. CCDF was funded under the Child Care and Development Block Grant. It's overseen by the Office of Child Care within the U.S. Department of Health and Human Services. CCDF provides child care subsidies and funds for quality improvement programs. The human concern behind CCDF. Before CCDF, many low-income families struggled to afford quality child care. Lack of affordable child care limited parents, especially single mothers, from maintaining employment or pursuing education. CCDF was created to reduce child care barriers and support economic stability for working families. As this image shows here, you see a stressed out mother trying to balance both child care and work. Background and history. The CCDF originated in 1990 under the Child Care and Development Block Grant Act, which aimed to assist working parents with child care expenses. Over time, the program evolved to focus more on quality, health, and safety in early learning environments. In 2014, Congress reauthorized the act, adding stricter standards for training, background checks, and health requirements for providers. As shown in the chart, you can see the plan development. Phase 1 is to collect, review, analyze relevant data and resources. Then you go into phase 2, where you inform partners and organize work groups, and also review draft preprint when released for comment. It goes on through stage 3 and phase 4 to complete the cycle for plan development. Who does CCDF help? CCDF serves families who would otherwise struggle to afford childcare. The primary beneficiaries are low-income working parents or those enrolled in education or training programs. Children under the age of 13 or up to 19 if disabled are eligible. The program also benefits child care providers who receive funding, training, and resources to improve the quality of their care. How does CCDF work? The CCDF operates through a federal to state funding model. The federal government distributes funds to states, territories, and tribes, which then administer their own child care assistance programs. Families typically receive help in the form of vouchers or certificates to pay for licensed providers or direct payments to approved child care centers. States also use funds for training providers, improving facilities, and ensuring compliance with safety standards. As you can see here in the graph, we go from the federal government, the state agencies, and then finally the families and providers. Eligibility requirements. To qualify for CCDF assistance, families must meet certain criteria. Income must be below 85% of the state median income. Parents must be working, attending school, or participating in job training. And lastly, children must be under 13 years old or under 19 if they have disabilities. Each state may also prioritize special populations, such as children experiencing homelessness, foster care, or those with special needs. Program impact and statistics. The CCDF currently serves over 1.5 million children every month across the United States. Annual funding exceeds $8 billion, reaching millions of parents and thousands of providers. The program has led to improved school readiness for children, increased employment stability for parents, and an expanded professional development for child care workers. As you can see in the two images provided, numbers served, approximately 1.5 million children and 900,300 families per month receive child care assistance in 2020. And the numbers have increased since then. Reasons for care. 87% reported that families cited either employment or education and training, and 10% of families cited protective services. Challenges and limitations. Despite its success, CCDF faces ongoing challenges. Limited funding prevents all eligible families from receiving support. Uneven implementation across states causes access disparities. Balancing cost, quality, and provider reimbursement remains difficult. These challenges highlight the ongoing tension in child welfare programs. It's difficult to ensure both accessibility and quality without overburdening providers or family. As you can see, I added a scale to symbolize the imbalance of finances throughout the states. CCDF and social work connection. The CCDF aligns closely with social work principles by promoting economic justice through access to affordable care and supporting family stability and child development. Also by encouraging advocacy for policy reform and funding equity. As social workers, we can play a role in connecting families to these resources, helping them navigate eligibility and advocating for improved child care systems. Conclusion and call to action. The Child Care and Development Fund is a lifeline for millions of families. It not only provides financial assistance, but also promotes stronger, more resilient communities. The key takeaways from today's lecture. CCDF supports parents' economic independence. It ensures children have access to safe, enriching care, and its continued advocacy is needed to expand funding and accessibility. The end. Thank you.